Medurstand, Understanding Medicine.
I am Professor Aziz-ur-Rehman, and after completing 4 modules on X-ray chest, we are going to discuss the role of CT scan and MRI in the diagnosis of common condition and common conditions which can be diagnosed by internist also. I always say that you can have much better opinion from the radiologist because they are expert in this field, but every internist must know the basics of imaging and they must be able to read common CTs, common MRIs and common conditions which are diagnosed on CT. Now these are two machines, they look very similar. This is CT scan machine and this is an MRI machine, and both they look similar, and this is the table. Patient typically lies on this table, and this is motorized table, and whichever part of the body you need to image, that part is moved into this V-like structure, and because this is the part which takes images and this is the part which also emit radiation. This is the magnet part, and I'll explain to you basic physics, but of course not in detail. So these two are very similar looking machines. MRI is generally speaking more sophisticated, more expensive, and the latest, and the CT scan is relatively cheaper and is been in the market for longer period. CT scan introduction, it is the sophisticated form of X-rays. The basic technology in imaging in CT scan is the same X-rays. CT is actually computerized tomogram. Tomogram is like a section of something. The first terminology when it came into being was CAT, computerized axial tomogram, because we could take images only in this axis, in one axis. So it used to be called CAT scan or CAT scan. But nowadays, because some other images can also be taken, not necessarily axial, so now we call it CT scan. It is the sophisticated form of X-ray. In X-ray, you see the image which is created by the transmitted X-rays. In this case also the image is made by the transmitted X-rays, but when you see the image you actually see a cross-sectional image, because multiple images are taken and then computer make one picture which is very much like a normal cut section of the structure. Instrument and principle, it's based on that ring-like thing. It emits X-rays in the form of beam, and there is a detector on the opposite side. Traditionally, the first machine had 16 detectors, then 64, then 128, and the modern machines, they have even more detectors. And what is the importance of number of detectors? Because that means the image will be acquired on a very very fast. The total time needed to image one area will be less. Plus, the main advantage is that you can actually image a moving object also, like coronaries. That is the advantage of these 128 slice CT scan. Spiral is, in traditional CT scan, one image is acquired, then the table moves by say 2 centimeter or 1 centimeter depending upon the slice thickness, then another image is taken, then another one. But in spiral CT scan, the image is acquired so fast that table moves almost continuously, and the detector, the radiation, the detector is actually constant. The two which emits radiation just passes like this, and it is as if you have made a spiral. So it's a very fast machine and very fast, multiple slides taken at a short period. Because of the ability of acquiring images very fast, it became possible to take the images of small structures which are moving, like coronary CT angiography. You could take angiogram of coronaries, carotids, any actually vessel can be imaged with this technique. Similarly, you can have MRA, like you can have arterial structure seen on the magnetic resonance imaging also. In the MRI, the basic physics is that, our body has multiple molecules, and one thing which is the most abundant in our body is water. Water consists of hydrogen molecules, and most particles in the body are actually charged. They have positive and negative charge. And when a very strong magnetic field is applied across the body, suppose person is lying in that machine and there is a very strong magnetic field applied, and you know the basic principle of physics, the positive is attracted by the negative and negative is attracted by the positive. So at that moment when a magnetic field is applied, all the molecules in the body which are movable, and water is movable, it will realign in a way that positive become positive will be aligned toward the negative and the negative will be aligned toward the positive. In that process they emit some radio frequency waves. These waves are detected by sensor and they are converted into image. Since all tissues, all soft tissue in the body, they have variable component of water, say they create slightly different type of radio frequency waves, and they can be they produce a slightly different type of shadow, different intensity of gray, and they can be appreciated, they can be differentiated from other tissue. Then you will also be hearing about the terminology, very difficult to understand, T1 weighted images, T2 weighted images, flare images, functional images, like you could actually detect if any part of the brain is not functioning or functioning excessively, like in seizures, and many more. So it's a very advanced, very rapidly advancing field, and in future you would be seeing more applications of MRI. Very wide application. And then these machines, CT machine and MRI, both, especially if you want to image brain, then patient will have to stay in that tunnel-like thing, and some people they cannot do that because of claustrophobia. They have fear of narrow spaces. And in MRI, actually there's another factor also, because whenever that magnet turns on and off, the loud noise is produced. So patient who is not well prepared may be actually scared. So I think we need to explain to the patient that this is what's going to happen. So we have open MRI where that ring is slightly, I think they call it gantry or gantry I think. So that is slightly bigger, so that patient doesn't have that claustrophobic feeling. And there's upright MRI also, that is perhaps the best. But I know that the open MRI do not have that much, that better resolution. So if somebody is not claustrophobic, that person perhaps still can have a good quality images from the standard MRI machine. This is an upright MRI. This should be, of course, least claustrophobic. Person is sitting comfortably as if person is sitting in the business class seat of an aeroplane. And these are two magnets. I think this is the best perhaps in the market. Now both are CT scan and MRI, both are imaging techniques. Practically both can acquire image of all structures, but there are some specific application, and I'm going to compare them so that you have better idea. The principle of CT is actually X-rays, whereas the principle of MR is magnetic resonance. This is radiation and this is without radiation. So we know radiation can have some harmful effect. So this may be potentially harmful, especially in pregnant women. We can't do CT scan, but this one is considered safer in small children and elderly. Cost, both are expensive machines as compared to normal X-ray, but CT scan cost is definitely much less than MRI. There are two reasons why MRI is more expensive. One, it is the latest machine and it requires more hardware. Plus, it takes more time per person. So with the same machine, you can serve more patients when you do CT scan. But if you do MRI, because it takes longer time, so you will be able to serve less number of patients. So of course, the per patient, the cost would be more. Availability, CT scans are more widely available as compared to MRI. Time per person, CT scan has become very fast, especially these multi-slice spiral CTs. The average time for CT for any body part like chest or head would be less than 15 minutes, whereas in MRI, average time is 45 minutes. So those patients who are claustrophobic, they would have more difficult time when they undergo MRI. Sensitivity, CT scan is sensitive, but MRI is much more sensitive. That means small lesions were better detected on MRI, especially in the soft tissue. Contraindications, if the person is irritable, the CT scan is not possible. Somebody is having seizures and cannot maintain one position for a few minutes, the CT scan is not possible, and it would also not be possible if patient is irritable. MRI would also not be possible, but MRI is also not possible if somebody has this metallic implants, because the magnetic field is so strong, it can pull that metallic implant in the body. For example, somebody is having pacemaker and that could be displaced and that could lead to serious consequences. So whenever you go for an MRI, the technician will ask you if you have any metallic implants. Bone structure interference. When we do CT scan, X-rays pass through the bone and then the soft tissue. When we consider brain, we can still get a very good quality image because the proportion of bone is much less as compared to the soft tissue. But when we want to image spine, for example, this CT scan will not give you good quality image. Whereas MRI is almost independent of bone. For MRI, as if bones do not exist. So in those parts of the body where there's a lot of bone and less soft tissue, good example is spine, then MRI has got very good advantage because it is not affected by the presence of bone. Spinal cord and brain stem, MRI gives you much better image. Acute stroke. Now acute stroke is something which is common, very common, perhaps the commonest brain emergency, and you want a quicker diagnosis and you want to go for a test which is also available. So I think here CT scan is a winner, yes, because CT scanners are available in more centers and it takes much less time, and especially if you're considering thrombolysis or thrombectomy, the time is actually the money, so you can have CT scan much faster than MRI. So there is, I think, CT is a winner. Others, CT scan, primarily you get axial images. Of course, you can reconstruct other images also. The computer will do that for you. But in MRI, you can acquire image in any direction. So generally speaking, if you are looking for some soft tissue lesion like a tumor in the adrenal gland, I think I would go for MRI. If you are looking for small lesion in the brain like multiple sclerosis, tuberculosis granulomas, a small tumor, pituitary tumor, I would go for an MRI. But if you are suspecting CT, this hemorrhage, acute stroke, I think I would first go for CT, and if needed, later I will go for an MRI. So this is both are of course great machines, but I've given you a comparison to let you decide which one you would consider as investigation of choice whenever you need it. Now, reading a CT scan or MRI is some basic principle, I think, hold the film correctly. Very interesting. Now, the best way to do that is if you can read the label. If you can read the label correctly, that means you're holding the film correctly. And then put the film in sequence. Typically, the whole brain, for example, when it is imaged, you would have 3 or 4 films, and you must put them in proper sequence so that you can identify. You must orientate yourself by putting this film in proper sequences, and then you can see them. And orientate yourself with a guide. I'll show you what I mean by guide. And of course, experienced radiologists, they do not need this guide, but internists, especially when they're training themselves, they must take the help of this guide. I'll show you what I mean. Then know what you're looking for. Eyes can see only what mind knows. So if you are not looking for multiple sclerosis, you can easily miss these small lesions. So if you know the history well, then it is more likely that you will be able to pick up these subtle abnormalities. Compare your finding with the radiologist report or vice versa. Now, I typically read the films first, make my own judgment, and then confirm with the radiologist reports. And then, of course, if I miss something, then I correct myself. So I think this is how you learn. First, try to make your own diagnosis and then confirm it with the radiologist report, which of course is the standard one, and you can compare your opinion with that radiologist. Correlate with clinical condition. I think in any investigation it is important, but particularly true when it comes to imaging and CT scan. Okay, this is what I meant by guide. You see, these are the lines. Typically, if the CT scan is done, CT scan of the brain, multiple slices are cut. These lines are representative of various slices, and usually from below upward. Now, this will show the base of skull. As you move up, then you see more bone structure, and then when you are above this point, then you will be seeing just scalp and then the soft tissue brain. So I think this will be very helpful to orientate yourself and to read the images better. This is the nasal cavity, teeth, and pharynx, and you can all see. This is MRI, and normal MRI. And one thing you can learn on an MRI is the normal structure. So this is also very good, but I'm going to show you the normal anatomy in another slide. Now, a typical MRI is shown. This is MRI. You can tell, although more or less the images are the same, but this one is MRI because you have better resolution. Now, starting from the base, you remember I showed the guides. This is the very basic, the lower level. You see the brainstem, you see some part of the cerebellar hemisphere. Then most of white things are bone, and then you see some part of the temporal bone and the sinuses and nasal cavity. And you move up, you see more cerebellum, and then here you see the temporal lobes also. The cerebellum is better seen. You can see the eyeballs also. In eyeballs, you can actually see these lenses also. They look very opaque. Maybe the patient has cataract. I'm not sure, but lens you can clearly identify. Both orbits and both eyeballs can be seen. Here you see move upward, and then you see more of brain, and these are actually the roof of the orbit. And this is falx cerebri. This is a small area of the choroid plexus, and then you go up. So this is how you see all the images in a proper sequence. Although these are two-dimensional images, but when you see in sequence, you actually construct a three-dimensional image in your brain, in your mind. Now this is the brain anatomy. You can't really appreciate it better. So see, this is such a nice thing. Now for example, this one is sagittal. Sagittal is a section cut like this. Now you can identify various structures. This of course is brain, and you can appreciate sulci and gyri. And this one is corpus callosum, and this is the ventricle, the lateral ventricle, the central body, and then this is the hypothalamus. This is optic chiasm. This is pituitary gland. Then this is brain stem, and this thing rounded up as thing is pons. This is the medulla oblongata, and it continues the spinal cord. This part is cerebellum. You can identify this very interesting structure. This is cerebellum, and this is that we call tentorium, the ligament which separates the cerebrum from the cerebellum. On this, you again appreciate the sulci and gyri, and you can actually tell the white matter. You can differentiate white matter from the gray matter. See, these are gyri. Outer side is the gray matter, inside is white matter. Frontal lobe, these are frontal lobes, these are parietal lobes, then this is occipital lobe. You can see the caudate nuclei. This one is caudate nucleus. This one is again, I think that tracks pyramids, and these are ganglia, thalami. This is the ventricles, the lateral horns of ventricles. See this one, and then this is the line which separates two sides of brain, and this is the scalp, and you cannot appreciate all the linings, but this is actually dura. So interesting. I think you can appreciate the normal anatomy. If you do not know the normal anatomy of brain, I think one way to learn is to read a normal MRI. CT scan versus MRI, more or less they look same, but you can compare them. This is CT scan and this is MRI. MRI has got better resolution, less granularity, and more demarcation of various tissues is much better. See, this one is CT scan, and there is some granularity. The demarcation between gray matter and white matter is not as clear as you see it here. So MRI images are better quality or better resolution than CT scan. These are choroid plexus, which are seen as calcified lesion. This is not hemorrhage. Hemorrhage is different. I'll show you when I have a CT scan of hemorrhage. Now, some of the indications of CT scan of brain are, first of all, I think it has got an extremely important role in the diagnosis of CVA, cerebrovascular accident, and particularly ischemic stroke and hemorrhagic stroke, but it also have very good role in the diagnosis of subarachnoid hemorrhage and subdural hematoma and epidural hematoma. So very important role of CT or MRI in the diagnosis of various types of cerebrovascular accidents. Various tumors, meningiomas, astrocytomas, metastases, even pituitary tumor, they can be diagnosed on CT scan, particularly in MRI. Similarly, brain abscesses, granulomas, tuberculomas can also be diagnosed on these conditions. Multiple sclerosis is a relatively difficult diagnosis only if you have high index of suspicion, and then you look at the X-ray and the CT and MRI particularly, you may be able to find those classical paraventricular plaques. I will be showing these CTs, MRIs in my next third module. But you need to have high index of suspicion. In the initial part of multiple sclerosis, MRI may look just normal, so we can only suspect multiple sclerosis. Only in the subsequent films we will be able to make a proper diagnosis. hydrocephalus primary or secondary can be diagnosed on the CT and MRI, and brain atrophy is another condition, particularly MRI will show you. I will be showing all these images in my subsequent lectures. So many more actually. So this was actually very brief account about the CT scan and MRI. Thank you very much for your for attending this lecture, and this was very brief. Much more is coming in my next video, which is particularly important. I'll be discussing various types of strokes. That is very important for internists. And the third one I will be discussing relatively less common. So with that, I'd like to thank you and look forward to see you in my next lecture. Thank you. This is Professor Aziz-ur-Rehman from Medurstand.